Namaste. I'm Dr. Rachita Sarangi, consultant Retina and Uvea Center for Sight group of eye hospitals in Hyderabad. There are two basic types of age-related macular degeneration. We call it either the dry type or the wet type. Dry or the degenerative type is where patients come with mainly blurry vision in the center, making it difficult for them to read. This dry degenerative disease, I'm afraid, does not have any permanent solution. We just treat it with antioxidants to prevent further damage. But the one that causes more problem in vision is the wet type of age-related macular degeneration, and the treatment for this now mainly is by intravitreal injections we give. May have to give multiple injections, and the patients have to be under stringent follow-up even after that disease has been stabilized. In the wet age-related macular degeneration, also with treatment we can save your vision. So please do get your regular checks done. To talk about retinal detachment, we need to know a little about the eye anatomy. So this is the cross section of the eyeball, where you see that the cavity inside is filled with one gel called the vitreous gel, and that layer behind, the orange layer that is attached to the back of the eye wall, it's like a film. That is the retina, which is the visually most important part of the eye. One of the most common complaints I have in my OPD is what is called as floaters. I'm sure most of you have noticed this black spot, moving with the movement of your eye. Sometimes patients describe it as black spots or threads, sometimes cobwebs, a lot of things. But what the floater means is this vitreous gel inside your eye is actually aging. And when the gel ages, it liquefies. So when the gel liquefies, it moves. It has an independent motion along with the motion of the eye, and that is what casts shadows and we see the floaters. Now, floaters per se, obviously not a disease, nothing to do about it. But when there is a symptom of floater, you will have to come for a retina check, because what that can do is that aging gel can actually pull on the retina. So we do a retinal check evaluation to see whether that pull has caused any break or hole in the retina. Another symptom that patients come to me with is flashes of light. So what that means is when this aging gel is pulling on the retina, it causes a sensation of like a lightning flash in the corner of your eye when actually there will be no stimulus for it. This is not when you're looking at light directly, this is just happening randomly. Or sometimes patients come to us with a complaint like, there are fireflies, doctor, that are flashing in the corner of my eye sometimes and just going away by themselves. So that symptom is called flashes. Any of these two symptoms, floaters or flashes, you need to come for a retina checkup immediately. When you come to us at an early stage, when you're noticing the symptoms of flashes and floaters, we do a check. If it is still at the stage of a hole or a break, we do a laser around that hole or break to seal it up so that it doesn't develop into a retinal detachment. Because once the retina has detached, we have to operate it surgically, and sometimes the damage done is permanent. Now, a retinal detachment leads to a sudden loss of vision. And the faster it is reattached by a surgery, the more visual acuity that the patient regains.
Follow Center for Sight and post your queries to get answers from the experts.